Welcome in to Anchor Talk Psychology. My name is David Kapolis, and I'm a licensed psychotherapist living with bipolar disorder. I discuss all things psychology related. Today, we're going to have a brief short on the topic of what we call positive psychology. This is a movement that came out around, I believe it's 1998, with Martin Seligman, who at the time was the president of the APA. And what positive psychology is, it almost seems too obvious, but what's positive psychology is, it's a focus on the positive aspects or the strengths of the individual seeking help. This was actually a bit of a wide shift and divergence from what we had before. And this is going all the way back to Freudian times, where we would oftentimes clinicians would focus solely on what we call psychopathology. Another word for it is mental illness, psychiatric conditions, problems, issues, maladaptive behaviors, a million different ways to chop that up. But essentially what this shift to positive psychology, what it did, it made it so that clinical assessments would have a different framework where it wouldn't solely focus on the illness, right? Or we wouldn't solely do psychometric tests looking at, say, for example, major depressive disorder symptoms or the severity of generalized anxiety disorder symptoms, OCD, etc. It wouldn't solely focus on that. It would also include some sections that would say, what are your strengths? Right, and what are you good at, right? So we know that there's an issue here. We know that there are some problems, but what are some of your strengths? And for some folks, when they come to me, they're like, oh, they have a really hard time with it, right? They're just like, oh, I'm in a bad place, not feeling great about myself. It's hard. It's oftentimes very hard for them to come up with a strength. And then over time, we start kind of like unpacking that a little bit, and we're realizing, well, people have more strengths than they realize, right? They just don't always see it, especially with a depressed brain or an anxious brain biochemically, right? So when we're talking about positive psychology, now at this point, it's an entire school of psychology that focuses on, again, strengths. So not only does it focus on identifying the strengths, it asks the question, how can we utilize those strengths clinically, right? In other words, how do we recognize the things that we are good at or our positive attributes, and how do we use that in our everyday life to not feel negative feelings, right? Or to not engage in maladaptive or dysfunctional behavior, right? So when I ask that question clinically, it usually catches people off guard, right? Because I ask a whole bunch of questions about, what's going wrong, of course, because it's a complete necessity. We have to know what's going on, right? It's not all fucking roses, right? Otherwise, people wouldn't be talking to me, right? So, but when we bring in the positive psychology piece, I always see it have a shift in the way that my patient is even holding himself, right? You start asking that question because you go through so many questions of like, okay, so what are your symptoms? Have you ever been previously hospitalized? What medications have worked for you? What hasn't? What therapies have worked for you? What hasn't? What are some things that got in the way? Tell me about your family history. Do you have a trauma history? Okay, that's a lot of shit. That's a lot of negative, potentially negative stuff. I mean, it's important, but I mean, it's not the greatest thing to be talking about back to back to back. So when I get into the assessment, I say, hey, so what are your interests? What do you like to do for fun, right? Because sometimes people's interests are their strengths. For example, someone likes to rock climb. Well, hey, that says a whole lot, right? That says like, well, this person's pretty brave, or you're pretty diligent. It's not an easy thing to do. I have a few patients who rock climb, and I'm like, count me out. I'm not doing that shit. I don't trust myself with heights at all. But all the power to them. So, again, when we're looking at our strengths, we're talking about the sort of like the holistic view of what do we mean of all things. What do we mean when we say like all things strengths related, right? Coming from a positive psychology view. Another way of looking at positive psychology and utilizing it is saying, hey, what are some things that have worked for you in the past, and what have you worked through in your life, right? Like, in other words, we're measuring resiliency. I don't say that, but that's what we're measuring. Like, what is your capacity for your resiliency? And people, countless times in my practice, have completely underestimated their own strengths, their own abilities, and again, the positive aspect of their life and themselves, right? Because when we feel like shit, frankly, we tend to think like that. And then we tend to behave that way. Carl Rogers called that congruence. That's a different video, though. I'll do that another time. But it's not always so easy to identify what your strengths are, because oftentimes you're not feeling like you're in a good place. So it's really hard to say, I find that I'm resilient, or I find that I'm good with people, or I'm a good communicator, or I'm intelligent, or I am musically inclined. I'm multi-talented, multifaceted. I make a lot of friends. I'm able to do that. I have a lot of connections in my life. I'm a self-starter. It almost sounds like a job interview, which people do tell me sometimes. They're like, "Oh, it kind of reminds me of a job interview." It's like, well, it's not an interview for a job, but it's an interview for me to understand you from a holistic standpoint. All right, and it's a really important question to ask that a lot of clinicians don't ask. I picked this up when I was working in community mental health. At the pre-licensure level, when I was working in what we call in Massachusetts wraparound services, wraparound care. And we would have to do assessments. The acronym was CANS, but it's a child assessment of needs and strengths. So it was actually it was a pain in the ass assessment, but it was actually a good way of framing things, because instead of looking at like problems, it was like needs. It was a good little cognitive reframe, and I'll do a video on cognitive reframing another time. But it was a nice way of like reframing the issue. Okay, what does this child need, right? And then what are their strengths? And then how do we utilize their strengths to meet these needs? For example, if I was working with a child who was having major behavioral problems, especially in the classroom, say they were diagnosed ADHD, executive functioning is very poor. In other words, they're not able to really control themselves very well. Executive functioning has a lot to do with concentration and working memory and focus and things like that. And so this particular child had an issue with behaviors in class and low impulse control. We would ask the question, well, what is this child's strengths? And we'd sometimes have to dig deep. And the strengths would be like, well, so-and-so is really good at Minecraft. How can I use that clinically? Well, Minecraft takes a hell of a lot of creativity. And so he also was able to concentrate while engaging in Minecraft. So could we translate that? And we did. We found that what this particular kid needed was to have some sort of stimulation. And we took big, thick elastic bands, and we put them on the legs of his desk so he could bounce his legs. And that simple movement of him bouncing his legs it gave him the ability to concentrate in class. So there's a really good example of using a strength, like utilizing a kid's ability to play video games well, and utilizing that in the classroom, right? So like he is able to concentrate. He just needs to be stimulated the right way, right? And that goes for adults too, right? So say you have somebody with severe anxiety, and this particular person has high anxiety and has significant symptoms, heart racing, inability to concentrate, a lot of physiological things like that. And we would say, hey, in what scenario were you able to overcome your anxiety? And a question like that is useful, because someone would always come up with a really good answer. Like, well, I was able to give a presentation at work in front of like 75 people. It's like, well, there you go, right? So again, positive psychology, 1998, Martin Seligman, very useful tool to use. It's not just focusing on the psychopathology, right? We need to focus on that because that's important. Because if we don't have a framework of a diagnosis, then we don't know how to treat it, right? But just adding that extra piece, positive psychology. What am I good at? Okay, I know. It's human nature to hyper focus on their issues or perceived issues, and kind of put everything else to the side. All right, we call that mental filtering, right? And we filter out the good, and we just focus on the bad. So utilize positive psychology in your life by when you're not, for example, when you're not feeling great about yourself, thinking about your strengths, thinking about even the littlest of things, all right? And that can really help. It makes a big difference, right? So that way you're not only just seeing the sick parts of you, or the parts of you that you don't like, or the parts that, we need to work on, right? Kind of have to offset that a little bit. Otherwise, you're only getting one slice of the pie, and you're not seeing the whole picture. So, again, David Kapolis, Anchor Talk Psychology. See you next time.